What is chiropractic? Chiropractic is a healthcare profession specialized in the diagnosis, prevention, and treatment of neuromusculoskeletal disorders. It offers a conservative and non-medicinal management of back and limb pains. The chiropractor employs all the therapeutic techniques recommended for the management of neuromusculoskeletal disorders, such as manipulations, also called chiropractic adjustments, joint mobilizations, or soft tissue work. Before he or she takes care of a patient, the chiropractor eliminates the risk of any underlying serious diseases. Besides manual therapy, chiropractic care allows to evaluate the psychosocial factors which may influence the pain, recommend exercises or physical activity, do educational therapy to help the patient manage pain. What is pain? The International Association for the Study of Pain defines pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. If this pain is new and recent, it is referred to as acute or subacute pain. After 3 months, the term is chronic pain. If this pain tends to frequently disappear and reappear, it is referred to as a recurring pain. Some additional information about pain. Pain is an alarm signal supposed to protect the self. Thus, it typically plays an adaptive role. Additionally, pain can also have negative effects on function and on social and psychological well-being. Pain is always a personal experience, influenced to some extent by biological, psychological, and social factors. Among these factors reside stress, pessimism about the painful experience, the lack of physical activity, or false beliefs. How does the chiropractor take care of patients? A chiropractor consultation runs in 3 steps: the anamnesis, the clinical examination, the treatment. During the anamnesis, the chiropractor asks the patient about the chief complaint, the medical and family history, and their life habits, etc. This establishes a list of probable diagnoses. During the clinical examination, the chiropractor tries to reproduce the patient's symptoms. Neurological, orthopedic, and clinical examinations can be done, along with a palpation looking for the potential origin of the pain. If the case is within the chiropractic scope of practice, the chiropractor proposes then an adapted treatment plan, considering the patient's symptoms and profile. The proposed treatment is guided by the patient's expectations and preferences, the clinical expertise of the clinician, and the available scientific evidence. In the patient's interest, the chiropractor collaborates with other healthcare professionals for a multidisciplinary management of the pain. When the condition of the patient does not occupy their scope of practice, or if they consider that any further examination is necessary, the chiropractor refers the patient to a medical doctor. What is the treatment like? Each chiropractic treatment is individualized on the basis of the patient's needs and expectations, according to the treatments recommended in the scientific literature and the therapist's experience. It is made up of 2 steps. The chiropractor will first try to relieve the pain and/or limit the incapacity, then to limit the recurrence of the pain or incapacity, and to improve the patient's quality of life. One of the chiropractor's tools is the vertebral manipulation, also known as the adjustment. It is a forced, high-velocity and low-amplitude move applied to a body joint. The scientific literature shows that the vertebral manipulation diminishes the pain and improves the function in some musculoskeletal disorders, including low back and neck pain. When a segment is adjusted, you may hear a crack. This tiny noise seems to be caused by the liberation of an air bubble in the joint. It is not systematic and, most importantly, is not painful. The mobilization is not a forced movement and does not include an acceleration move. It is done to one or several adjacent joints to solicit the mobility within the limits of the articular physiology. The soft tissue work on muscles and tendons consists of muscle reflexes techniques, stretching, muscle contractions, relaxations, ligamental frictions, etc. The chiropractor also recommends simple exercises and stretching in order to help the patient manage pain, retrieve a natural mobility, and become active in their care. He or she may also help the patient adopt healthy practices and provide advice to limit the recurrences, sport practice, nutrition, sleep, stress management, or ergonomics of the workstation. Let's now turn to the origins of chiropractic. Chiropractic was founded in the U.S. in 1895. D.D. Palmer claims to have done, that year, a vertebral manipulation allowing his patient to recover his hearing lost 17 years earlier. From there, D.D. Palmer formulates a principle that says an entity, called subluxation, is the sole cause of pathologies, and that the chiropractor only could identify and treat these subluxations by adjusting the vertebrae. This principle has since been questioned by the scientific literature, but remains well established in a part of the profession. In 1897, D.D. Palmer and his son, B.J. Palmer, opened the first chiropractic school. The profession, contested and prosecuted for illegal practice of medicine for many years, subjected itself consistently to criticism and sought to prove its efficacy. From the 1970s, the profession evolved with the division between those who advocated for patient care based on subluxation and those who defended medical diagnosis and evidence-based practice. This contemporary scientific approach, patient-centered and based on scientific evidence, is widespread within the profession and strongly supported by the representative institutions, such as the World Federation of Chiropractic. In France, this was the approach mandated by the state authorities when chiropractic was legalized in 2002 and regulated in 2011. How do you become a chiropractor? The education to become a chiropractor is internationally standardized. An independent organization, the Council on Chiropractic Education, defines these standards and certifies the chiropractic colleges that meet them. In France, since 1983, chiropractors are trained in IFEC, Franco-European Chiropractic Institute. It is the only institution entitled to deliver a chiropractic degree, considered a master's degree, accepted in more than 40 countries, and registered in the National Directory of Professional Certifications. The 5-year curriculum consists of almost 5,000 hours of training, distributed in lecture courses, tutorials, and internships. The classes include 9 fields of study: fundamental sciences, anatomy, symptomatology, study of symptoms, clinical sciences, chiropractic treatments, human sciences, research methodology, and integration of knowledge and know-how. When they have validated the 85 classes and completed their internships in hospital sectors, in liberal practice, and in the school clinical center, and passed their final exam, the recent graduates can work as chiropractors in France or abroad. Has chiropractic efficacy been scientifically proven? Scientific research has shown that techniques used by chiropractors were secure and efficacious to treat back and neck pain. In 2019, in a British medical journal editorial, 11 points have been recommended for a better management of musculoskeletal disorders. The chiropractic arsenal covers all of these points. Its other benefits are currently being investigated, notably in IFEC, but also in other worldwide chiropractic colleges and universities. Research is also being conducted on neuromusculoskeletal disorders epidemiology, i.e., their frequency and the factors that may influence them in a positive or a negative way. To summarize, pain is an alarm, informing us that something is not working properly. Chiropractic can help relieve musculoskeletal pain, limit incapacity, and improve recovery without medication or surgery. You can use it at any age and regardless of your profile in order to prevent your joint pains or treat them and improve your quality of life.